Patient. I've been a registered therapist for approaching 34 years now. And the very first person I ever evaluated as a student, when somebody has a stroke, they say, well, the shoulder is going to be stronger than the elbow, and the elbow is stronger than the hand. Usually the hand is the hardest to get back, and it doesn't come back quickest and everything. And so the very first person I ever saw, if you propped their hand like this, they could totally move their hand, but they couldn't move their shoulder or their elbow. So as a student, still not in the field, I kind of said, okay, well, let's take the treatment cookbook and throw it out. And ever since then, I've kind of done it my own way. So I look at the world a little bit differently than most people do. When you're dealing with a physical therapist, typically what they say is, oh, you have a shoulder pain. Okay, let's look at your shoulder, and, well, we need to check your neck, we need to check your elbow just because they're nearby. My thing is, if you have a shoulder pain or a leg pain or whatever, you treat everything in the body that could influence that pain. Get rid of it as best you can, and whatever's left is the shoulder problem. Because so many things relate into that area that people don't give credit to. For example, you, how high up are you?
All the way up.
All the way up, okay. You, besides phantom limb pain, before even that, was yours traumatic, or did you lose it in an accident?
Yes.
Okay. One of the things I found with people who have arm pain, for example, is there's 4 different spots in the body that can trigger an arm pain, totally independent of each other. And most of them, they're all basically related from here to here. But the point is that when you're dealing with the pains that a lot of you go through, it's not necessarily where you think it's coming from. It can be from a lot of different places. We have to look at that. So, who here has had phantom limb pain? Who here still has it?
Really, really, really bad.
Okay. Who has it less than they used to have it? I was specifically talking to Charlie because I've worked with Charlie twice in the last week and a half to try to decrease some things on him. Use him as our example for today. But, all right, who here has had a doctor say, we don't know what causes it? So they know what causes your phantom limb pain?
I don't know. It's been since '99.
Okay.
He just gave me pills to get rid of it, and it never went away.
Okay,
So
so
the answer
he
is no.
obviously doesn't know what caused it because he can't fix it. Okay, he either knows what caused it and doesn't know how to fix it, or he doesn't know what caused it.
He told me the fingers would disappear, and then the palms would disappear, and it would just work its way up.
Yeah.
And since '99, I still have really, really, really bad pain,
Okay.
and it has never.
All right.
I see so many amputees, and I talk about this so much, and I'm with doctors with the amputees. The consensus seems to be, the brain still thinks that the foot's there, so now what causes the pain, I'm not sure. They don't really know that. Nobody knows the cause of the pain, but we basically give patients ways to at least try to alleviate. We've got a number of different things we do.
And what do you do?
I'm a prosthetist.
That's what I thought. Okay.
And I'm an amputee. I lost my foot when I was 18.
So you're a BK? Okay. Well, long residual limb or fairly standard size?
6 inch.
6 inch
Yeah.
standard, okay. I'm going to probably sound fairly arrogant for the next few minutes because, see, I think I do know a lot of times what causes phantom limb pain. And it drives me nuts that other people don't think they know too. Because I'm not any spectacular Joe. I mean, I'm just your basic therapist who tries to pay attention. Been in the field a long time. I do a lot of out-of-the-box kind of treatments, a lot of manual techniques, myofascial release, muscle energy, strain counterstrain. You may or may not have heard of any of these techniques, but basically it's where the therapist, heaven forbid, actually touches you. And those of you who have had therapy before know that sometimes that's not always the case. Give you some exercises, give you this, give you that, maybe do a little massage, stuff like that. But I come from a little different approach on that. just like pretty much everything I do in therapy. So anyway, my feeling is that one of the major situations with an amputation is, well, first off, when you have an amputation, whether it's traumatic or diabetic or planned, let's put it that way, whether it's planned 5 minutes before because it's an emergency, because all of a sudden they've noticed you have gangrene in your toe or something like that, or it's diabetic and they say, okay, we have to take your leg off, that sort of thing, or your hand or whatever it is. Either way, there's a surgeon involved. What do surgeons do?
Cut things off.
Well, you cut things
They
off,
cut.
sew them up, or whatever. But it always has to do with the whole. It always has to do with changing parts a little bit and then putting them back together, sewing them back together. And what does the surgeon typically say when they're done? Well, the surgery went great, the incision looks terrific, and then they come in a week or two to your room or on an outpatient basis, and they say, healing nicely, looking good, straight incision, not a whole lot of swelling, we're good. Should have pain for about 6 months and it'll go away. Anyone heard that one before? Maybe a year. Okay, well, most of the docs who say that have not had an amputation themselves. And if they did, chances are they would either be a lot clearer on what was going on, or they wouldn't tell you what they're telling you. And, like I said, it's going to sound kind of, I'm going to send my doc bash for a little bit because it drives me nuts. I do a lot of scar work. I mean, a ton of scar work on patients. Part of my background is 8 years of working almost exclusively with chronic pain patients. My average patient that came to me had seen 10 doctors, 2 of whom said you're nuts and you need to have psychological counseling and see a psychiatrist and be managed that way. Had gone to at least 4 physical therapy clinics and had been off work for at least 2 years. That was my average patient I was seeing for a significant period of time. And it got to the point, especially on my women, that I would, instead of saying, well, have you had any surgeries, thinking possibly scar problems, it was, okay, Mrs. So-and-so, what surgery have you had of gallbladder, appendectomy, hysterectomy, C-section, or there's a 5th one I'm forgetting, hernia. 90 to 95% of my female patients with chronic back pain had one of those 5 surgeries because the scar put so much stress on the body that their back couldn't cope with it, and you get all this incredible pain, you get all these shifting and changes in the body alignment, all this sort of stuff. Has anyone noticed any changes in body alignment since they've had their amputation? Sure. You're running into the class the thing we've talked about. He's above the knee, and the contraction you watch out for above the knee is the leg flexes up and pulls out to the side. And he hasn't. And already you're starting to change that. And that's a good thing. So we made a couple of changes in the approach and how he's looking at his leg. But, all this stuff about scar things, really what it comes down to is a little story that I tell my patients, and that is that we have this woman, and she sews her own stuff all the time, and she's invited to this really elegant party. And the party attire is that you have to have a skin-tight, full-length outfit, your basic jumpsuit kind of thing. And so she said, I can do that. So she makes it, looks great on her, feels great. She hangs it up in her closet, waits for the day. So the morning of the gala, she goes and tries it back on again. And she notices that some gnomes have come into her room and put a big seam in her outfit. So because that seam wasn't there when she did it, now it's there, is that going to change how the outfit moves? Is it going to change how it fits?
Yep.
Okay, so think of this. sometime every single one of you was sleeping and a bunch of gnomes called physicians came up and put a seam in your birthday suit. Then is that going to change how it fits? Is that going to change how it moves? So, see, what we have is we've got to try to get back the same mobility of the fabric and get rid of some of those seams that are causing you to have problems. And that's one of the biggest issues I see with people that have either just pain from their amputation or phantom limb pain, and that's their scar. Now, one of the things that I've worked with Charlie only twice, but he had some significant puckering in his scar. It was really intense. You've had 13 surgeries on your leg?
Since the amputation.
Yeah. Okay, so 14, including the amputation. Okay, so he's got a lot of